Welcome to Marina Hills Animal Hospital. It's our weekly staff meeting, and we're going to talk about seizures today for a medical moment. A seizure is when there is abnormal electrical activity sweeping over the brain in an uncoordinated fashion. And it is big and dramatic, usually, and it turns out that the muscles of the back are stronger than the muscles of the abdomen. So when pets are having this uncoordinated event, first of all, they lose consciousness, they're not aware of what's going on around them, and their body has big active motor activity. They're flopping around, they're exercising, and typically their head goes back. They often urinate and defecate in the midst of a seizure, and sometimes they foam and drool. If you see it, you know something's really happening. Sometimes clients come home and there's evidence suggesting that a pet may have had a seizure. For example, there might be a pile of urine by the door that's been spread out because during the seizure, pets sometimes, while they're exercising, they're pooping and peeing and spreading stuff around. Sometimes clients come home and find the mess, but they never saw the event. But then looking back, they go, oh, well, maybe that was a seizure that happened previously. One seizure in and of itself is typically not very dangerous unless the pet harms themselves in the midst of it. Like, for example, if you're walking next to the swimming pool when you have your seizure and fall in, you could drown. Our pets don't operate motor vehicles, so they're not in car crashes, which is good. Though it's quite frightening, one seizure by itself that lasts about 30 seconds to a minute typically is not particularly dangerous. The danger from seizures is when they cluster. If one seizure is followed by another, that can become quite dangerous. Primarily because during seizure, our pets are exercising, they are not panting to cool themselves, so their body temperature goes up. And if seizures follow each other, one on another, their body temperature can go way up, and they can actually have hyperthermia. They can cook themselves, and so we don't want that. When a client brings a patient here to the office that's having a seizure, if they're in the midst of a seizure, the first thing we do is give medication to break that cycle. And typically we give injectable Valium, and it works quite quickly. Though it's short-acting, it generally is potent enough to stop this episode of seizure. The next thing we do is we ask the question, why did this seizure happen? And broadly speaking, seizures are caused by a couple different kinds of things. Sometimes the reason for a seizure is found in the bloodstream. For example, low blood sugar, the brain can go hungry and a seizure can occur because the brain is hungry. Or toxins or poisons that the pet has ingested. Generally those toxins are kept out of the brain by a thing called the blood-brain barrier. But sometimes those toxins or poisons that are encountered in the environment do affect the brain directly. So by doing routine blood work, we look for evidence of toxins or poisons that might point us to an understanding of why the pet's seizuring. If blood work is normal, there's no history of exposure to toxins, the blood sugar is normal, then we focus our attention on the brain itself. And sometimes there's a history that really points to a clear cause, like head trauma. Okay. Sometimes previous head trauma that can result in scar formation. Scars can trigger seizures. Pets that have previously been bitten by rattlesnakes, for reasons we don't always understand, are at higher risk for seizure later in life. Dogs who survive the viral infection distemper, sometimes seizure later in life. So talking with the client, getting the history, sometimes will point us to an understanding of why the pet's seizuring. But often it's not at all clear. It just seems to be coming out of nowhere. In that situation, if we want to keep pursuing the question, the next step is that we refer folks to a specialty center that has an MRI so that they can actually physically look at the structure of the brain. And sometimes when the MRI is done, there is an obvious cause. A mass or a tumor could be present. There could be inflammation associated with a parasite in the brain. But sometimes even the MRI is normal. And if there's no anatomic thing that we can point to, then fluid can be collected from around the brain that's called a CSF tap, and that can be analyzed for evidence of inflammation or infection or cancer. But if the CSF tap is normal, we're left with every test is normal, but the pet is seizuring. And that can happen. Frustrating, but true. In that situation, we have to call it something, so we call it epilepsy. And epilepsy, broadly speaking, means you're having seizures and we don't know why. Epilepsy is most often seen in young animals when they're 2 to 3, 4 years old. If an older pet starts having seizures in their old age, it often correlates with an actual anatomic problem in their brain, a tumor or something like that. Still could be epilepsy, but most often epilepsy is seen in young pets. The obvious next question is, well, thanks, but what do we do about it? My pet has seizures, what are we going to do? And the answer depends on how severe the seizures are, how severe and how frequent the seizures are. If seizures are rare, singular events that happen less than once a month, we often choose to do nothing except keep the pet safe away from the swimming pool and monitor to see if the pattern changes. If seizures are clustering, meaning more than one seizure in a 24-hour period, or if the seizures happen frequently, meaning more than once a month, we often consider putting them on medication to block seizure from occurring. Now, the goal is not necessarily that they have 0 seizures. The goal is that the seizures never cluster together and go into this hyperthermia of one seizure after another after another. There's lots of medications that can be used to manage seizures. The traditional one that's been used in veterinary medicine is phenobarbital, and it works, and it's inexpensive, and over the long term it sometimes has side effects, particularly changes to the liver. An alternative is potassium bromide, which is a salt that can change how quickly cells depolarize in the brain, stabilizing nerve function in the brain. And then there are a host of newer drugs that have been developed for human medicine that are being used more and more in veterinary field, particularly as they become generic, so the price is coming down, which helps, because some of these newer human drugs are quite expensive. Anyway, that's the story on seizures. Any questions? Yes?
Does potassium bromide have as many side effects? What is it? Why would you choose? What makes you decide phenobarb versus potassium bromide?
So potassium bromide, it takes a fairly long time to build up drug levels, and it's very salty, so it can change electrolyte balances. So pets with heart disease, we might not choose it.
Okay.
But I do have good luck with one or the other, and there's sometimes when we use both. If one by itself is not working, then we can use both.
And then, if you consider a pet epileptic in its younger life, are they going to always be epileptic, or does that seizures come in?
It's a good question. So the answer is it depends, and we don't know. And so sometimes, if we've had a pet's seizures well controlled for a long time, more than a year, we might try an experiment of tapering them off of their seizure medication to see if they still need it. But if we ever do that, if we ever change seizure drugs, regardless of which one we're using, we always slowly taper them off. Because it turns out that if you stop them abruptly, then that can actually trigger seizures. But there are times when we can try a pet that's been well controlled, weaning them slowly off, and if they never seizure again, we go, well, isn't that interesting? And it's gone. Yeah. Good question. Yes?
Can a dog bite its tongue while having a seizure?
Can a dog bite its tongue while having a seizure? The answer is yes, they certainly could, but they do not swallow their tongue. There's this myth that somehow a dog or a cat is going to swallow their tongue during a seizure, and so someone should put their hand in their mouth and pull their tongue out. Really bad idea. Yeah, guaranteed you will be bitten if you put your hand in the pet's mouth. So while they can actually thrash their head around, and they can bite a lip, they can bite their tongue, they can bruise their head. So in the midst of a seizure, keeping their head padded so that they're not bashing it against things is helpful. But you don't need to try to put a stick in their mouth or anything like that. That's not helpful. Yeah, good question. All right, good. Thanks.